I'm Neil Marshall, President at Consonus Pharmacy. We talk a lot about how we support and care for people on their life's journey and helping them live the best rest of their life. The current outbreak of COVID-19 is showing us just how unpredictable that journey can be. With so much still unknown about this new virus, it's natural to feel fear and apprehension, and at some level, I think we all do. As a society and healthcare profession, we've never been in this place before and never faced a pandemic like this, and we're navigating all of it together for the very first time. What's especially concerning is that we're caring for a population of people who are at much higher risk than the rest of the population. This virus is acting differently for the elderly, the people we serve, and the risk of mortality is much higher. A person who's 80 years old with a chronic disease and a compromised immune system has more risk factors than a young person. When we look to the path of this virus in other countries, the most risk has been to the elderly. I want you to know that as we navigate through the myriad of decisions and actions, we're always going to prioritize the health, safety, and wellness of the patients we provide care for and our staff. We'll treat every person in our care and each other like we would our own family members. We're being realistic about this. Our first priority is to do everything we can to keep the COVID-19 virus from entering our pharmacies and the care settings that we serve. But at the same time, we're also planning for what happens in the event that it does, and how to take every possible action to contain it. In other words, we're going to hope for the best and plan for the worst. In all of our decisions and practices, we're aligning with guidelines and recommendations from the Centers for Disease Control, the American Healthcare Association, and state health authorities. As we all partner together to ensure your safety and the safety of those we serve, I want to share some things that you need to know. First, this situation demands that we keep you informed. Today, you've likely visited the COVID-19 update page on Connect Me. We'll continue to use that to keep you updated. Second, we're taking all the steps that we can to protect you and your families. We've been operating at level 2 in our infection prevention and control policy since March 6th, and effective Saturday, March 14th, we're escalating that to level 3. That change limits us to accept only essential visitors to each of our pharmacy locations. By essential, we mean those critical to maintaining safe, continuous operation. That includes, for example, delivery drivers and sanitation service providers. Third, we've developed clear guidance on when you should come to work and when your health indicates that you should stay home to protect yourself and others. Finally, as we've probably all experienced at some point, it's in life's most challenging times that we see people all around us rise to inspiring new levels of courage, compassion, and service. For all of us, this is more than just a job. We chose this profession in order to give of ourselves, in order to rise and serve in defining moments just like this one. We've proven that we'll always be there when a resident or patient needs us. I also want to thank you for all the work you've done so far, and I'd ask that we continue to stay focused and do our very best to execute. This is a time that will continue to test our resolve and calls upon each of us to bring our professional best to every minute of every day. I'm proud to say that I know we're up to the challenge. No one knows for sure how long the journey through the COVID-19 pandemic will last. But I do know one thing with absolute certainty. Whatever time it takes, we'll be there for each other and the patients we serve. Thank you.